The North American Menopause Society reports that 7 out of 10 women over 60 continue to feel sexual desire, but more than half believe they are doing something abnormal. So how much is too much? And when does a private habit cross the line into harm? Hello, I'm Dr. Eliza Hart, a board-certified gynecologist with over 15 years of experience helping women navigate menopause, hormone shifts, and intimate health. I've spoken with thousands of women who carry this same silent question, am I normal? And what I've learned is that the silence itself is often more harmful than the act. Today I want to give you not myths or taboos, but clear science-based answers that can help you reclaim confidence in your body. Society has long suggested that after menopause, desire should quietly fade away. But biology doesn't work that way. In fact, research shows that touch and intimacy, even when practiced alone, can improve circulation, calm the nervous system, and support better sleep. The problem arises not from the act itself, but when guilt, secrecy, or imbalance turns something natural into something draining. Many women over 50 are left wondering, how do I know if I've crossed the line? That's the gap we're closing today. Before we dive in, I'd love to hear from you. If this is a topic you've ever questioned or felt curious about, type 1 in the comments. If it doesn't resonate, type 0. Your feedback helps me tailor future videos to exactly what you need. And don't forget to hit subscribe and turn on the notification bell so you won't miss upcoming conversations designed to guide you through life after 40 with dignity, balance, and health. 1. There is no one-size-fits-all number. When women hear the question, how much is too much, they often expect a chart, a neat answer, or a prescribed frequency that would tell them exactly where normal ends and excess begins. But medicine has never produced such a number, and for good reason. Every body is different, every stage of menopause is different, and every woman's emotional landscape is unique. To apply one standard across millions of women would be misleading and in many cases even harmful. As a physician, I have seen how quickly arbitrary rules can create unnecessary fear. A woman might feel guilty for enjoying self-touch several times a week, believing she has crossed a boundary when in reality, her body is responding in a healthy and balanced way. Another might believe that spacing months between moments of intimacy is healthier, yet feel increasingly anxious, restless, and disconnected from herself. Both women are listening more to myths than to their own physiology. This is where confusion thrives because silence leaves space for misinformation to grow. The reality is that sexual health, like cardiovascular health or bone health, cannot be reduced to a single measurement. We do not tell a woman there is one exact number of steps she must walk per day to maintain her heart. Instead, we teach her to watch for the signals her body gives. In the same way, intimacy is not about counting frequencies, but about recognizing outcomes. Does the habit leave you restored, calmer, and more centered? Or does it leave you tired, sore, or distracted from daily life? The answer to whether it is too much begins with those honest observations. What I want you to remember is that self-care in this area should blend seamlessly into the rhythm of life, not feel like a compulsion or a secret duty. The moment numbers dominate the conversation, the human experience gets lost. What matters is not how often, but how you feel. And once you accept that there is no universal benchmark, you are free to listen more closely to your own body without fear of failing some invisible test. In truth, the healthiest measure is not external, it is internal. Paying attention to your sleep, your energy levels, and even your mood the next morning often reveals more about balance than any guideline could ever provide. This understanding forms the foundation for everything that follows, because once the myth of a magic number is removed, we can finally turn toward the real benefits of balanced self-pleasure, and why it may be far more restorative than many women realize. 2. The benefits after 50 and 60. Now that we have removed the myth of a fixed number, it is time to look at why self-pleasure practiced in balance can be not only safe, but profoundly beneficial for women beyond menopause. When I sit with patients in their 50s, 60s, or even 70s, what surprises them most is not that their desire still exists, but that science fully supports nurturing it. The benefits reach far beyond the moment, extending into physical health, emotional balance, and overall quality of life. From a physical standpoint, gentle stimulation serves as a kind of therapy for the pelvic region. After menopause, declining estrogen leads to reduced blood flow, thinning of tissues, and increased dryness. This can make daily comfort difficult even outside of intimacy. Regular arousal helps counteract these changes by improving circulation, maintaining elasticity, and keeping vaginal tissues healthier. The North American Menopause Society has noted that consistent blood flow is crucial in preventing discomfort, and self-stimulation is one of the simplest ways to achieve that naturally. But the impact does not stop at the physical level. There is a profound neurochemical response that follows orgasm, releasing oxytocin, dopamine, and endorphins. These chemicals are the body's natural stabilizers. They lower stress hormones, lift mood, and reduce the perception of pain. I often remind women that this is not indulgence, it is biology. Just as exercise triggers endorphins that support heart health, intimacy supports nervous system health. Many of my patients report that after incorporating balanced self-pleasure, their sleep improves significantly. Research from the Journal of Sexual Medicine confirms this, showing a measurable improvement in sleep onset and quality among women who engage in regular self-touch. There is also an emotional and psychological benefit that cannot be ignored. For many women, post-menopause can feel like a time of loss when the body seems unfamiliar and confidence wanes. By choosing to engage in intimacy with themselves, they rediscover ownership of their bodies. The act becomes a reminder that pleasure is still possible, that comfort and closeness have not expired with age. In some cases, this renewed confidence even improves relationships because women feel less fearful, more connected, and more open to sharing intimacy with partners. These benefits, however, only tell one side of the story. For self-pleasure to remain truly restorative, it must be balanced. Too much can tip these benefits into risks, and that is where the conversation must go next. 3. The risks of too much. After appreciating the genuine benefits of balanced self-pleasure, it is equally important to face the other side of the equation. What happens when balance is lost? Many women hesitate to ask about risks, fearing the answer will be judgmental. But let me reassure you, this is not about shame. It is about protecting your health and understanding how your body changes after menopause so you can continue to care for it wisely. One of the most immediate risks is physical irritation. With estrogen levels lower, the skin and tissues of the vulva and vagina become thinner and more delicate. What may have felt comfortable in earlier years can now cause friction, redness, or even tiny tears that take longer to heal. Without sufficient lubrication, soreness may linger for days, and that discomfort can easily discourage women from continuing healthy habits. In my practice, I often explain that the goal is not to stop, but to adjust to give tissues the gentleness and support they now require. The second area of concern is emotional well-being. Pleasure is healthiest when it is a conscious choice, not an automatic response to loneliness, stress, or boredom. When self-touch begins to feel less like comfort and more like compulsion, it can leave women feeling empty or restless afterward. This shift is subtle, but significant, because it replaces relaxation with unease. Instead of contributing to balance, the habit starts to drain emotional reserves. Secrecy can also become a hidden risk. When women carry private guilt or hide their needs from a partner, the distance that secrecy creates can erode intimacy rather than protect it. I once counseled a woman who, after decades of marriage, felt she could never tell her husband about her private habit. When she finally did, their relationship grew stronger, not weaker. Openness transformed isolation into connection. Finally, the overall impact on daily life must be considered. If the habit leads you to stay awake too late, skip meals, or neglect meaningful activities, the scale has tipped too far. The true purpose of intimacy is to enhance life, not to push aside the things that make life rich. Now, I'd like to hear from you. Have you ever noticed moments when a healthy routine started to feel excessive? Share your thoughts in the comments. Your experiences might encourage another woman who silently wonders the same. And remember, acknowledging the risks is not about fear, but about protecting the very benefits we discussed earlier. 4. Recognizing the warning signs. Knowing that risks exist is one thing, but learning to recognize them in your own body is where true protection begins. Many women expect that too much will announce itself clearly, but in reality, the signals are often subtle. That is why awareness is essential. Your body is always communicating, but you must be willing to listen. Physically, the first red flags often appear as lingering soreness, redness, or discomfort that does not resolve quickly. A common scenario I encounter is a woman who worries she might have developed an infection when the real culprit is simply overuse without adequate lubrication. These tissues, already thinner after menopause, need more recovery time. When they are pushed beyond comfort, they respond with irritation, and that irritation is your body's way of saying pause. There are also emotional warning signs, which can be even easier to overlook. Healthy self-pleasure usually leaves you feeling lighter, calmer, and more at ease. When instead you find yourself restless, guilty, or dissatisfied afterward, that shift is telling you something important. The habit may no longer be serving you. Instead, it may be controlling you. I often describe this distinction with one question: am I choosing this, or is this choosing me? If it feels like the latter, balance has been lost. Lifestyle disruptions are another clear signal. If you notice that your routine is interfering with sleep, delaying meals, or pulling you away from activities you normally enjoy, then it has begun to occupy too much space in your life. Self-care should never cost you your energy or your relationships. The moment you feel that the habit is subtracting rather than adding, it is time to reevaluate. Other women describe a more subtle shift. They no longer look forward to the experience with anticipation, but approach it with urgency or anxiety. That change in emotional tone matters because pleasure should be restorative, not pressured. When the act begins to feel compulsory rather than chosen, it undermines the very relief it once provided. Listening to these signs is not about judgment. It is about respect. Respect for your body, your energy, and your well-being. By tuning in early, you can prevent small irritations from becoming larger problems, and you can redirect yourself toward a healthier rhythm without fear. Recognizing these warning signs sets the stage for the next crucial step: learning practical strategies to keep your habits not only safe, but restorative. Because once awareness is in place, action becomes possible, and that is where lasting balance is found. 5. Practical medical guidance. Awareness alone is not enough. Once you recognize the warning signs, the next step is to take practical action to protect your health and make intimacy truly restorative. Too often, women assume that change means restriction or even complete avoidance. In reality, most adjustments are simple, gentle shifts that allow you to continue enjoying pleasure while minimizing risks. The first adjustment is physical protection. After menopause, tissues are thinner and more vulnerable, which means lubrication is no longer optional, it is essential. A high-quality water-based lubricant reduces friction, prevents micro tears, and helps the skin recover more easily. I often compare it to sunscreen. Just as sunscreen protects you during healthy sun exposure, lubrication protects you during healthy intimacy. It is not indulgence, it is basic care. The second adjustment is pacing. Think of your intimate tissues the way you would muscles after exercise. They need rest days to recover, and alternating days can prevent irritation from becoming persistent. This does not mean you must follow a rigid schedule, but rather that you should remain mindful of how your body feels. If soreness lingers, take a pause. Recovery is part of longevity, and respecting that rhythm ensures you can continue safely for years to come. Even something as simple as varying technique or duration can reduce strain and make the experience more comfortable. Beyond the physical, it is also important to consider the underlying reasons for your habits. What appears to be too much is often the body's way of signaling another need: loneliness, stress, or disrupted sleep. In those cases, intimacy becomes a substitute rather than a complement. I have seen patients naturally find balance once they began walking daily, joining a social group, or addressing vaginal dryness with a moisturizer. When the deeper need is met, the compulsion fades and the habit regains its healthy place. Finally, do not hesitate to involve a physician when concerns arise. Persistent pain, unexpected bleeding, changes in discharge, or a sudden loss of desire all deserve medical attention. A compassionate doctor will not judge you. We are here to guide you, answer questions you may have carried in silence, and support you in protecting this intimate part of your health. And remember, these conversations are confidential, rooted in science, and meant to empower you, not to restrict you. Practical guidance is not about rules that take freedom away. It is about tools that give freedom back. And when you approach these adjustments with consistency and care, you transform self-pleasure into a practice that nourishes both body and mind across the decades ahead. 6. The 3 principles of balance. Practical tools are valuable, but what truly sustains long-term health is a framework you can return to whenever doubts arise. Over the years, I've found that 3 simple principles help women stay steady, listening honestly to their bodies, creating a gentle rhythm, and fostering openness. These are not strict rules, but guiding lights that keep intimacy nourishing rather than draining. The first principle is attentive listening. After any moment of self-pleasure, pause and notice the outcome. Do you feel calmer, lighter, or ready for restful sleep? Or do you feel sore, restless, or emotionally unsettled? Those signals are far more reliable than numbers on a calendar. Your body will always tell you whether balance has been maintained. The challenge is not in detecting the signals, but in giving yourself permission to believe them. Many women have spent decades doubting their instincts, and relearning to trust the body's feedback is itself an act of healing. The second principle is rhythm. Just as we benefit from steady meal times or consistent sleep routines, intimacy also flourishes when it has a natural cadence. This does not mean rigid scheduling, but it does mean choosing a pattern that respects both desire and recovery. For some women, a few evenings each week feel restorative. For others, occasional moments of comfort are enough. What matters is not comparison, but consistency, the assurance that pleasure has a place in life without pushing aside the rest of what makes life whole. The third principle is openness. For some, this means speaking honestly with a partner, which often strengthens rather than weakens intimacy. For others, it means bringing concerns to a trusted physician who will listen without judgment. Breaking silence removes the weight of secrecy, which is often heavier than the act itself. I have witnessed women rediscover confidence simply by speaking aloud what they once carried in private shame. Openness transforms fear into connection, and it often gives women the reassurance that they are not alone in their experience. Even acknowledging your own needs privately in a journal or in reflection is a step toward greater honesty. When these 3 principles are practiced together, listening, rhythm, and openness, they form a foundation that allows pleasure to remain a source of health rather than stress. They do not limit freedom. They protect it. By weaving these principles into daily life, you create a balanced framework that respects your body's changes and still honors your right to enjoy comfort. And by embracing them, you give yourself permission to age with confidence, dignity, and a renewed sense of ownership over your body. Practical guidance becomes meaningful only when it can be applied in daily life. Here are a few ways to begin or adjust your habits safely and confidently. First, consider frequency and rest. Rather than focusing on numbers, give your body space to recover. If you notice any soreness, take a day or 2 before resuming. Think of this as the same respect you would give your muscles after exercise. Small breaks prevent irritation and make the experience more comfortable over time. Second, use supportive products. A water-based lubricant should become a routine companion. It reduces friction, protects delicate tissues, and keeps the act enjoyable rather than painful. For women with persistent dryness, a vaginal moisturizer applied regularly can further improve comfort and elasticity. These products are widely available and safe when chosen without added fragrances or irritants. Third, address the underlying needs. If you recognize that your habit is driven mainly by stress, loneliness, or sleep problems, combine intimacy with other supportive strategies. Gentle evening walks, stretching meditation, or social connection can reduce the pressure placed on one single outlet. When your overall well-being improves, self-pleasure naturally finds a healthier balance. Finally, keep communication open with yourself, your partner, or your physician. Writing a brief note about how you feel after each experience can help you recognize patterns over time. Sharing concerns with a trusted partner or doctor removes secrecy and builds confidence. Applying these small adjustments consistently ensures that intimacy remains a practice of self-care, not a source of harm. By treating your body with gentleness and awareness, you preserve both the benefits and the dignity that this stage of life deserves. As we close this conversation, I want you to pause and reflect on what we've uncovered together. The truth is simple but powerful. There is no universal number that defines what is normal or excessive. What matters most is how your body responds and how the habit fits into the flow of your life. Balanced self-pleasure supports circulation, reduces dryness, calms the nervous system, and restores sleep. But when it becomes too frequent, too harsh, or too secretive, it can take away the very benefits it once gave. The best protection lies in awareness and care. Listen closely to the signals your body sends, whether they are signs of ease or signs of strain. Support your tissues with lubrication. Give yourself recovery days, and remember that sometimes what looks like excess is simply a signal that another need like companionship, relaxation, or rest deserves attention. These adjustments are not restrictions. They are investments in your long-term well-being. Above all, never carry your questions in silence. Speak with a partner if you have one, or bring your concerns to a doctor you trust. These conversations are not only safe, they are essential. Silence feeds shame, while openness restores dignity. If today's message has lifted even a small weight from your shoulders, then you have already taken a powerful step toward balance and self-acceptance. You are not broken. You are not too old. You are a woman deserving of confidence, comfort, and vitality. Thank you for sharing this time with me. If you found these insights helpful, please subscribe. Leave a comment with your thoughts and share this video with another woman who may need to hear it. Together, we can replace silence with knowledge and fear with dignity.